Most welcome. Today, I'd like us to take us through diabetes. My name is Gogi Bruno. And what is diabetes? Diabetes is a condition where the body is unable to produce insulin or produces little insulin. This causes the blood sugar levels to be higher than normal. Insulin is a hormone produced by the pancreas to help the sugar in the cells, which is converted into energy. Then the complications include stroke, because diabetes really affects the nerves. It is also a sister to heart diseases, abnormal lipid profiles. Then diabetes really affects the heart muscles. It also affects the pancreas, which is responsible for production of insulin. Women would experience abdominal periods and infertility. Arthritis is a major issue with people with obesity and also with diabetes. There are inflamed veins, because diabetes really often affects blood clots and issues of. We give practical solutions to problems like sleep apnea, lung diseases, liver diseases, gallstones, issues that come because of being overweight. Then diabetes is a disease that occurs when your blood glucose, also called blood sugar, is too high. Blood glucose is your main source of energy and comes from food you eat. Insulin is a hormone that helps glucose from food to be used in the cells properly. Normally, type 1 is usually genetic, and type 2 is more of insulin resistant. And for most people, the risk factors could be being inactive, your age, and since I'd mentioned that high blood pressure and the diabetes are not really far off, it's also a risk factor. So diabetes is a chronic disease that occurs when the pancreas does not produce enough insulin, or when the body cannot effectively use insulin in it. So hyperglycemia, or high glucose in the blood, is a major issue. Then there is hypoglycemia, where there is low blood sugar. Insulin is a hormone that regulates the blood sugar and that is produced by the pancreas. But most people would have a glucometer besides the bed just to measure what their level of glucose is. This is a concern. According to statistics, they're saying 1 in 11 are already experiencing diabetes. And this leads to other complications, increased in the premature age where people are dying. Most people with diabetes end up getting amputation. I know 4 friends within 2022 who have already gone through amputation. Kidney failure also is a major factor for these friends, and heart attacks, blindness because of the cloudification of the eyes when there is a lot of deposits of glucose in the eye socket. Then there is stroke, which contributes paralysis to most people. So we are talking about 3.7 million deaths due to diabetes and high blood pressure, and 1.5 million deaths caused by diabetes. So this is 422 million adults that we are losing to diabetes. So 24 million adults are already living with diabetes. So we are talking about 13 billion spent on healthcare across the world. So according to statistics, 95% of diabetes is actually type 2, which is a major concern for us, especially now that the cell is not able to access the glucose to make you more productive in terms of energy. The circulation system is also affected by the same amount of glucose and too much sugar in the blood. So our major role is to help the person who is normal not to cross over to pre-diabetes or to become diabetic. So if you keep on testing and checking, so the symptoms are like most people are too exhausted no matter how much they rest. So more people are trying to lose weight because of trying to control the amount of sugar in the body. The infections that come from UTI is not a very interesting thing. You drink enough water but still feel thirsty. More people, if you're peeing more than 8 times and if you're having blurry eyes, you feel starved even when you eat. So those are the major issues. So the vitamin deficiencies, B12 deficiency in B12 is a major issue for diabetics, especially now that you need that in your cell. Vitamin B3 should be supplemented when you're diabetic. Vitamin D, vitamin E should also be part of your diet. Vitamin C forms the collagen and also very good for hemoglobin. So that's a necessary one. Inositol is a component that you need in your body to prevent neuropathy. Carnitine, glutamine, coenzyme Q10, which helps with the vasodilation and vasoconstriction of nerves. Glutathione and lipoic acid. Zinc is very good for healing. Magnesium for your nerves and also for sensitivity. Important for your coordination. Biotin, chromium, amazing for your cell receptors to increase glucose uptake into the cell, because deficiency of insulin could be a major issue when you're diabetic. Now, the signs and symptoms, just as I earlier said, if you're above 40, it's important that you look at the risk factor, and if you're living a very inactive life, it's now time to switch off and start being more productive in terms of movement, in terms of exercise. More women, when they've had a gestational diabetes, we can still improve their metabolism. Family history, if one comes from a genealogy where the one has been affected by diabetes. BMI, abnormal blood lipid levels can be tested. Then if there is impaired glucose tolerance can also be checked. The type 1 diabetes is usually reduced by insulin secretion in the pancreas, and more of the time we find that it's mediated in terms of immune response, and commonly in children and young adults. But type 2 is the common one. 95% of people who are experiencing diabetes have type 2 diabetes. This is commonly diagnosed in older people. If you're overweight, you're hypertensive, you're physically inactive, individuals that have a higher risk of developing type 2 diabetes. Then type 1 is autoimmune, and more cause is unknown for most people. But usually what we do is that we concentrate more on type 2, which the risk factors can be managed, and the gestational diabetes for women, for the pregnant women, especially if it's harmful to the baby and to the mother. Now, this is how a healthy insulin pancreas looks like, and because the glucose is able to get into the cell, the insulin receptor is functional. In type 1, the pancreas fails to produce insulin, so that means that glucose is in the blood but it's not able to enter the cell. Type 2 is where insulin could be there or less, but the insulin receptor is unable to accept the glucose. So this cell fails to respond to insulin properly. Now, why we address the difference between type 1 and type 2, in type 1 cannot be prevented or cured. The type 1 also, the body does not create enough insulin. In type 1, the cause is unknown, but mostly it requires insulin injections. In type 2, can be prevented through lifestyle modification. The body cannot create enough insulin to develop insulin resistance. Causes include genetics, aging, inability, obesity, and other things. But then, key on our issue is that when there is frequent urination, there is always someone who's thirsty, there's blood vision due to that exhaustion, there's tingling of the hand, sudden weight drop or gain. Those are indicators. If one is always hungry, the wounds that don't heal, irritability, dizziness, all these are factors to look at. But then for gestational diabetes, the way I earlier said, we would encourage you to look at your increased blood glucose levels, and especially when the lady is pregnant in the 3rd trimester. And most of this is that hormones interfere with the insulin action. So what we would do differently is that we advise you to eat 3 medium-sized meals per day. We'd also encourage you to do more than 2 snacks per day, to prevent frequent snacking if you can. You can balance the amount of carbohydrates, fats, and all that. And we can also advise you to avoid sugary foods in the diet, sweet drinks, and all that from time to time. You can look at the nutritional facts that can help you in the grocery choices. So the complications, because diabetes increases the risk of cardiovascular diseases and cerebrovascular diseases. So things like neuropathy, where the nerve damage is extensive, retinopathy where the eye damage due to claudication of the eyes, glucose deposit and all that. Nephropathy where the kidney damage because of the frequent medication, and then the nerves that are affected, the circulation is impaired. Then impaired immune response because the body is already fighting its own cells. Poor blood circulation to the limbs. That's why you're finding people are getting amputated, diabetic foot infections, peripheral neuropathy, heart attacks, permanent kidney damages, retinopathy that are indicated affects more people, causing more blindness around the world. Now, you can test diabetes, whether you're pre-diabetic, whether you're diabetic. You can actually keep on evaluating what amount of sugar is in the blood and control it. Now, anytime you take a meal, there's a sugar spike. So that's how we measure insulin. And also we look at the risk factors that are at play and how best to address the symptoms, especially if you're always tired. The sugar needs to get to every cell. If you're always urinating, we have a solution for you. If you're always hungry, those vaginal infections from time to time, numb, tingling, feeling, always thirsty, losing weight, sexual problems, blurry vision, we have solutions for you. So our solutions are about giving you options apart from just being on medication for the rest of your life. We believe nutrition is the first line of defense, and the better you provide the building blocks for your body to repair your nerves, your cells, your legs, the gestational diabetes where the mother is at risk, the child is also predisposed, your liver, your heart, your eyes. Most diabetic people experience a lot of dental problems and nerve problems. So ours is to come in and give you a way to manage your diet and lifestyle, how to control your carbohydrates and fat intake, making sure that you're eating whole food, eating small frequent meals every other time, making sure you are hydrated. Exercise is as good as taking insulin for diabetics. So we would also encourage you to reduce the alcohol intake that you have. Then when we do that, the effects on diabetes will be controlled. Like if one is experiencing sexual problems, gum diseases, nerve damages, kidney problems, heart attacks and strokes, foot problems that could lead to amputation, eye problems that you're not able to see and read or do the meaningful things that you want to do with your eyes, we are within reach to help you. So cardiovascular disease is a major issue for chronic respiratory diseases and diabetes and cancer. So we look at the risk factor, like the cardiovascular problems that come because of diabetes, especially when there's too much sugar in the blood that's destroying other organs around it. The chronic respiratory diseases, the issues of mental and neurological conditions that come because of diabetes. The risk factor, especially if you're living an unhealthy diet regime, if you're smoking, if you overindulge in alcohol, if you are this person that is, I call them lazy bones, physical inactivity, really needs to alter that. Then for people who are experiencing diabetic retinopathy, especially when the eye vessels are getting affected by the sugar level in the blood, then the damage to the visual nerves, making it blurry, these are the causing leading of blindness. So there are treatment management options that are available, but we would still encourage you to go for regular checkups. This is very useful, especially for maintaining your body hygiene, especially your foot and oral, because the feet, we don't want you to get amputated, and oral that now the nerves are affected, and for most people, losing teeth, losing the gums are bleeding, and problems that occur from the mouth. So we also recommend that you take particular food. We would also encourage you to stay away from certain foods, the way I mentioned earlier. And if you monitor your blood sugar levels, you become more knowledgeable about diabetes. You look at your drug therapy from the doctor, look at the nutritional therapy or dietary therapy from our end. then you prevent complications and do your exercise, then probably we are on the right path towards controlling your diabetes. So diabetes leads to impaired immune system or immune response. So our Gymnema is to remove you from the sub-health category to a brilliant, wholesome life health. So where we start is that we give you Gymeffect. Gymeffect is designed to control blood sugar levels. Gymnema is a natural sugar blocker that has PQQ, which accelerates blood sugar excretion, but also improves the body metabolism. This amazing combination is good for your health, but also helps control blood sugar levels and prevent diabetes. For instance, if you reduce the sugar intake, the cravings, the sweet tooth that you have could also be controlled by Gymnema. Gymnema is a plant that is very effective for, especially the Gymnema sylvestre, very good for controlling the cravings. And even if you like taking a lot of sugary things, Gymnema lowers the blood sugar level and suppresses the swellings that come in your body, especially the coordination of the nerves. Now, we also give Gymese. Gymese is a mode of Gymnema. Gymnema is amazing for delaying glucose absorption to the blood, but this also dulls ability for the taste that is sweet. Then if it improves the cell function, B cell function, then we are looking at insulin secretion, but also reducing fat absorption. This is good for managing diabetes mellitus complications, even managing the weight drop and weight gains that most diabetics experience from time to time. Very good for wound healing. Yes, this is a major issue for people when they're diabetic, because now the wounds are not healing properly, they're taking too long to heal. Then Gymnema is good for controlling hunger pangs, like the frequent eating that you want to take a lot of sugar because the cell is starved of sugar. As we control this also, we look at your frequent urination. What is causing that? You're trying to eliminate sugar. Now, what we do is that Gymnema controls 95% of the type 2 diabetes, and for the 24 million people who are living with diabetes currently, this is good news for you. The next product is NMN. NMN is amazing for providing you with NAD+, which activates sirtuin in the body. Sirtuins are the defenders of the body. So this is 4,500 milligrams of high content of NMN to prevent diabetic foot. 98% of the pure content of NMN to prevent those irritability, blood vision, moodiness, tingling of feet, and amazing for addressing peripheral neuropathy, and also preventing things like heart attacks, ensuring that the blood is reaching every part of the body. So NMN is an amazing product for giving the body that defense system and also reducing the number of people who are experiencing diabetes. Like, this is an antidote for diabetes. So NMN is useful for preventing kidney failures, preventing amputations. NMN prevents neuropathy and permanent kidney damage. NMN is a good one for preventing eye damage. If you're already using more thick lens because of diabetes, this is an amazing product for preventing cardiovascular and cerebrovascular problems, prevents mental and neurological conditions. So NMN works towards even the collagen and even for the nerve endings in your mouth. Very good for sexual problems, for vaginal infections, because this is an immunity product that works wonders in terms of the DNA repair, the repair of the body, and actually gives you the cell energy, especially for people who are 40, 50, 60, 70, 80, and the body is now not repairing properly. NMN is amazing for giving you that insulin sensitivity to the cell. The cell receptors that need to take the sugar from the blood. So most diabetic patients would really benefit from this, especially for the tissue and for the repair of the nerves. So we also give 𝘿𝙄𝘼𝘽𝙀𝙷. 𝘿𝙄𝘼𝘽𝑚 as that component of Gymnema in a little compound, but also blocks fat and blocks starch and burns that fat. So powerful fat blocking and starch management. This is good for managing your diabetes very easily in terms of assisting the pancreas to produce the insulin that it requires. This also helps with the cell to get energetic as it gets that sugar thing. We give back ProBio because most people who are diabetic have taken a lot of antibiotics over the years. ProBio is amazing for helping you regenerate in terms of contains short chain fatty acids which improve cell insulin sensitivity and glucose response. Okay. Then I give 𝘿𝙄𝘼𝘽𝙀𝙀😏. 𝘿𝙄𝙼𝑚 is amazing for energy and also for appetite and for controlling that appetite because it regulates the endocrine system. And for most diabetic people, the major issue is you're feeling tired. So 𝘿𝙄𝙼 comes in to help the body repair and also to make it more effectively using the sugar. So this is Gymnema. Gymnema, what I was talking about earlier. Gymnema blocks sugar from entering the body and prevents heart diseases. And it has PQQ, which increases insulin levels to remove sugar. It has chromium, which enhances insulin functionality. So if your diet is high in fat and sugar, if you are overweight or obese, if you want to prevent diabetes, if you want to control your sugar immediately, then Gymnema keeps the sugar at bay. Then these are people that I'm looking at. The people who are temporarily keen on how best to manage their sugar levels. If you're feeling fatigued from time to time and you're storing in too much fat in the body, then Gymnema is your product. So this sorts impaired coordination, especially for people who are experiencing Alzheimer's. Gymeffect is also reducing the response to sugar, especially if you're this person that likes sweet tooth things, chocolate, biscuits. Gymeffect controls the cholesterol, which comes in handy for the people who already are experiencing high blood, heart diseases, and it's good for athletic performance because it helps convert stored sugar into energy, then helps sort the bipolar issue. And this is to block sugar from the blood and remove too much sugar from the blood from your system. So what Gymnema does, it supports the blood sugar level and controls it to normal range. It reinforces the function of the pancreas to store in muscles later energy. So if there is too much fat around the muscles, it's able to burn it. It supports the intestinal health and sugar absorption, also useful for weight management. So Gymnema is used by Ayurvedic herbs, but also very effective in terms of health benefits. Now, why are we looking at the chromium in the Gymeffect? This also helps with the healing, prevents, like people who are deficient in chromium, they would experience weak bones. They would, if you want to know that there's very little chromium in your body, your eye health starts degenerating. So chromium comes in to even help you in the concentration, and for neuropathy, when there's poor coordination of nerves around your body, people who have little chromium would experience skin problems, poor sugar control, and explain weight change. So all this is why I'm giving you Gymnema. Now, if you look at the science behind the gymnemic acid, which now the structure of taking sugar and the structure of taking Gymnema is almost the same. So what we did differently is to ensure that the Gymnema that we give you is able to transport sugar, at the same time able to help increase the insulin level so that the body can repair from the word go. So chromium is an essential trace mineral. 90% of the diets are low in chromium, but chromium is amazing, 10 times better than what we are currently taking as insulin. So once you take chromium, what you're doing is that you're giving you back the effectiveness of controlling your insulin. So if you look at the 3 ingredients in the Gymeffect, the first product is that it will improve the heart function. This blocks sugar from entering the body and manages it in a very intelligent way without it destroying the organs and the ligaments in the body. PQQ is an amazing product. It's called pyrroloquinone. That's why we shortened it to PQQ, because it's a scientific long term. then this resolves diabetes and good for athletic performance. If you want a sporty life, PQQ is your product. Then it has chromium, just as I explained the side effects of not having enough chromium. So this is chromium rich in yeast, which is amazing for metabolism and for controlling your insulin level. More people, the friends that have given Gymeffect who are diabetic, who are very happy that this product is very functional in 2 days. More effective in terms of reducing blood sugar levels, more effective in terms of preventing diabetic complications and heart diseases. That's why I send this out to as many people as possible. Other products that you can use with Gymeffect include 𝘿𝙄𝘼𝘽𝙀𝙀, Micro 2, 𝐷etoxyLife. So let me tell you a story about Micro 2. Micro 2 is very good, a great helper in preventing cardiovascular diseases. And Micro 2 is amazing even for your muscles. Just in case you're experiencing joint problems, please ask me for Micro 2. Then 𝘿𝙄𝘼𝑽 is also a part of the weight management kit, but since it contains Gymnema, I usually issue it out to more people who are diabetic. 𝘿𝙄𝑼𝑽 is amazing. It's a friend to your liver and superior in terms of, it's just a product that is made from soy lecithin, soya beans. And the 𝘿𝙄𝑼𝑽 is a friend to your liver because it controls the production of fat in your body, the lipids. It also takes care of the bad cholesterol. 𝘿𝙄𝑼𝑽 is an amazing product when it comes to addressing cardiovascular health. Now, the other top range products, because of diabetes, most people experience weakened immunity because the body is already in autoimmune war. This boosts and prevents UTIs in diabetes, especially for women. If you're having to go see the gyno more often than you need, or you are almost pitching a camp at the gyno, what we do is that when we give you Pure Unbroken, you are able to say bye-bye to your gyno. Now, what we do differently, instead of going for amputations because the wound is not healing properly, we'll give you Pure Unbroken. Pure Unbroken is a good product for preventing people who are diabetic from experiencing wounds that are not healing properly, because it's very rich in terms of phytonutrients that are very good for the defense of the body and encouraging of that healing. Okay? Then Pure Unbroken also corrects exhaustion, especially that feeling tired all the time even when you've rested. So Pure Unbroken comes in very handy in terms of addressing that. Then regulates your blood sugar, is very good in doing that, especially for those that are experiencing medication from tail to tail. This is a good product that you need to have. So NMN also, as I said earlier, improves insulin sensitivity in terms of being able to use your sugar properly in your blood. And also NMN supplementation increases the insulin sensitivity, as I've said earlier, and even age-related glucose intolerance, especially when you're about 50, 60, 70, 80, then you're experiencing age glucose intolerance, then this is your product. Some friends would say that NMN can reduce the brain cell death and oxidative stress that's caused by high blood pressure and high blood sugar. This oxidation, because of the free radicals that are attacking the cell, also the cell needs to be repaired. So if you're not repairing well the cell, you reach an age where the repair function of the body is going down. So you're finding the organs that are supposed to be renewing every other time are not doing so. So NMN comes in handy to help you with that particular role. Then I'd explain a little bit about Gymeffect. Then the 𝘿𝙄𝑼𝑽𝑽 I mentioned is very good for your liver, prevention for the cardiovascular diseases, ensuring that Alzheimer's is not part of your ecosystem in any way. Then if you look at lecithin in the 𝘿𝙄𝑼𝑽𝑽, which is soybean extract, is the third primary nutrient that you need in your body to improve the liver function and also to help you with the functionality of the body. Now, when you look at diabetes, what we do is that we'll give you 𝘿𝙄𝑼𝑽𝑽, we'll give you 𝘿𝙄𝑼𝑽𝑽, we'll give you Gymeffect and NMN, and we can switch it up to make it more value. So I would stop sharing there and get back to you, and I will be more than happy to provide support that we could, and I would like to stop there.